Good morning and welcome to DC Today. I'm Del Walters in Washington. We begin this morning with a friendly holiday reminder as we may be facing yet a new variant in the COVID saga. A mask may still be the best way to protect yourself, but not everyone who wears a mask is sinister. Now, I bring this up based on what was supposed to be a random act of kindness. An elderly woman struggled with her groceries in the parking lot. I saw her, but as I approached, she seemed at first to be startled. Was it fear of someone getting too close in these times of COVID? Or was she afraid that standing near her was a black man in blue jeans, baseball cap, and a mask? That caused her actually to quickly unload her groceries. And as she turned around, I said, "I'll take that cart back to the store for you." She smiled. It was that smile of relief and gratitude combined. We should not stop being kind to our neighbors, nor should we risk their safety during these times of COVID. Mask up. If not for you, for them. But we begin with that new COVID variant, international travel bans and new imposed restrictions. Our world travel these days scheduled around virus variants. The recent discovery of the Omicron variant sending governments scrambling worldwide. But here's the problem. The bans don't seem to make much sense. And joining us this morning is our chief foreign affairs correspondent, Nayera Hucken. And Nayera, Japan closing its borders to visitors. On Sunday, we heard from both the European Union, Germany, Italy, the UK, Belgium, Hong Kong, Israel, and Canada now reporting new Omicron cases. So what is the global consensus?
Del, the global consensus right now seems to be that fear is overtaking science, and that fear is also allowing for those countries that already had anti-immigrant and anti-migrant sentiment to have an excuse to close up their borders. Let's be frank, South Africa, which is where this variant was first discovered, doesn't mean it originated there, has one of the best tracing and reporting regimes in the world when it comes to science. So they did the right thing. Around the same time that they reported this up the chain and brought this discussion to the World Health Organization, we found that cases in Belgium and Hong Kong also appeared. So it has already become a global variant, but South Africa and its surrounding African countries, 7 total, are the ones that are made to suffer for doing the right thing.
And South Africa was very concerned during a COVID variant that they had early on, which is why we came up with a Greek letter system to name the variants. The World Health Organization noting that closing the borders sometimes has limited effect, but it actually has a huge effect on lives and livelihoods in those countries. But others argue that the closures actually buy time to analyze the new variant. So it's a mixed bag.
At most, it buys you about 4 to 6 weeks for governments to get a handle on additional data. That data would tell us a few things: how transmissible it is, which we already know it's very transmissible, and whether or not the current batch of vaccines, how much they hold up to it. Now, we know that being vaccinated is better against any variant that comes out because it gives you a baseline of protection. But what happens beyond that? That's what government needs data for. But let's be clear, it took long enough to report and make these decisions and gather as a global community under the World Health Organization umbrella that this is absolutely a global variant. And it would be no surprise if it's already in the United States. So it ends up being that these closures and travel restrictions are largely for political and potentially economic reasons.
But the public wants something to happen. Do we have a heads up yet on what the White House is going to say in the coming week?
The White House is likely to push for an additional vaccination campaign, but they're under the pressure of the holiday season, and it's not just a matter of people wanting to travel and be with their families. We saw record travel for the Thanksgiving holiday, looking forward to the Christmas season, but also they need the consumer boost. So they need people to be able to go and buy things to help boost the economy. All of that said, they will recommend that people continue to wear masks. That has been the most effective tool that we have in our hands as individuals to stop the transmission of the virus. But we're looking at what may be our new normal, Del. The new normal being you get a vaccine, you boost it up every year, and those who are not unvaccinated, those who are unvaccinated, who refuse to get vaccinated against everything from, say, polio to the flu, will be the ones to have to suffer from those diseases.
And Nair, we have to admit, though, personally, it causes all of us to alter what we plan on doing whenever we travel these days. We were planning a trip to the Middle East. My wife and I, all of a sudden we heard about Omicron and we said, not this year, maybe next year. This virus is affecting everyone and how we live our everyday lives.
Del, it's also a matter of vaccine equity, right? We've had the privilege here in the United States to reject good health and good science because we have a baseline of protection around us. We're looking at countries that are now on not only on the travel ban list, but who wanted the vaccine. And it's a matter of the economics of pharmaceutical companies and the choices made by Europe and the United States that they're not vaccinated. But South Africa is, once again, an interesting case study in all of this. Not only do they have a great reporting regime, they also are very well connected. Their middle class has also been suffering from what American middle class has, which is active misinformation campaigns about the vaccine. South Africa actually had enough vaccines to get to a good baseline of protection, but because of the misinformation being exported from the United States, they too are now suffering from coronavirus.